launching this, our 5th Partners in Recovery report. And I'm just going to share the slides with you so that we have that ready to go. Thank you for joining us this morning. It is absolutely a pleasure to have this opportunity. Can I start by acknowledging that I am on Gadigal country this morning and pay my respects to First Nations people and elders past and present. I'd also like to note that SVA accepts the generous invitation from the Uluru Statement and supports a constitutionally enshrined voice to Parliament. As someone who has spent most of his career working on social change and trying to create change at scale, I firmly believe this is a way to create a more reconciled Australia and is a pathway to achieving greater, better outcomes for First Nations people. If you are a supporter, I'd encourage you to talk to other people about why you support a voice. And if you're not, I'd love to hear from you because I'd love to have a conversation to learn more about your perspective. During the session today, what I'm going to do is I'll present the findings, some of the major findings from the report. There is a lot more detail in the report, and I'd really encourage you. There are a lot of people who worked quite hard to go over the detail to read it. Many hours of analysis have gone into the report. I'd also welcome your feedback. One of SVA's values is about being open and ready to learn. We're not pretending we have every insight. And certainly we would welcome your feedback and your knowledge and your expertise to improve the reports into the future. After I presented the findings, we are going to go to our wonderful panel this morning. And I'm delighted to have the Honourable Dr. Andrew Leigh, MP, the Assistant Minister for Competition, Charities and Treasury, joining us this morning. Andrew, thank you. I really appreciate it. I know your time is incredibly valuable and that you're also incredibly busy. We also have the CEO of the Centre for Social Impact, Arminé Nalbandian, and our wonderful partners in this project. We would not be able to do the level of analysis in these reports without the support of CSI and the team there. So I'm very grateful to them. And my wonderful boss and the CEO of SVA, Susie Riddell, is also joining us on the panel. And I'll go to them with some questions after I've presented the findings. You will, of course, as Rhonda said, have opportunities to ask questions yourselves. Please feel free to post questions in the chat. We will attempt to curate them. We may not get through every single question that's there. If you have detailed questions about what's in the data or the charts that I've shared, I'll do my best to respond to those afterwards as well if we can't get to them. But I'd really encourage you to think about the questions you'd like to ask of our panelists and of the Minister while we have that opportunity. Before I go any further, I also want to acknowledge our generous supporters without whom this project would not be possible. And so a big shout out to our friends at the Snow Foundation, Lord Mayor's Charitable Foundation and the AMP Foundation, some of whom I think will probably be on the call today. We're very, very grateful for the support. And I'm particularly grateful that these are organisations which can see the value of investing in trying to create systemic change, in being willing to invest in policy analysis and advocacy as a means to create a better Australia. So without further ado, I will get into the details of what we've presented. As people would be aware, if you've been following this journey, we started this Partners in Recovery series in order to try and fill a gap at a really critical time during COVID, when we felt like we needed some better analysis of what was happening to charities, particularly what was happening to the financial health of charities. And we hope that this can contribute to a better understanding and a better policy debate about what kinds of supports are required for charities to thrive so that we can have, so that all communities and individuals in Australia can thrive. We're also publishing this report now because we have some much better data after a couple of years about what has happened to charities. And as I mentioned, we're delighted to have the Minister on the line this morning. And we're also at a time where the incoming ALP government has committed to developing a new charities blueprint. And so it's a really important moment for us to be thinking about what are the things that are going to set charities up for success into the future. I will not go through this slide in detail, but just please be assured that within the report, and if you look in the appendix, you can see the detailed outline of our approach and the methodology that we've used to do the data analysis. The things that I will draw your attention to this morning are that the report is driven by a combination of analysis of ACNC data using the annual information statements that charities lodge. We've also looked at some of the CSI pulse data from our friends at CSI, and the range of published reports that are out there about what is happening to charities. And there's some wonderful work that we've drawn on, including from the likes of ACOS, from their surveys and other research which has happened to give us a better picture of what has actually happened to charities over the course of the last couple of years. With the data set specifically, what I will flag with you is that of the 48,000 charities that we were looking at for the data that was lodged on the ACNC website, we have removed some particular charities from the sample. So we've removed very small charities, charities where there was fewer than 0.8 full FTE, and charities that didn't provide data required for the analysis to the ACNC. In this sample, we do have a smaller number of charities that have been analysed in some of our previous reports for those who are really looking into the detail. It's quite important, just simply because we want to see what has happened with the drop and why that might be. We think that some of it may to do with late reporting, but again, if you go into the report, you will also see that we've been fairly circumspect about what conclusions we've drawn about how many charities may or may not have closed during COVID, because it is possible that particularly some of the small charities have dropped out of the sample for that reason, and we won't know the answer to that for sure for some time until we've got subsequent rounds of data. The last piece on the methodology is just to make it easier for people to understand as I'm talking and as you read the report about when I say which year we're talking about, because some charities report over different reporting periods. So for example, if we're talking about 2018, when I say 2018, I'm talking about all of those charities which reported in financial year 2018, as well as those who reported in the annual year 2018, and similarly for 2019, 2020, 2021. The other thing to note from this particular chart, this particular table, is that it's quite important, and you'll see it becomes very important to the analysis as to when JobKeeper actually was actually being distributed to charities. And you'll see that it falls very clearly over 2020 and 2021. And you'll see it also had a profound impact on the analysis that we've done. So I'm going to give you the highlights right at the start about some of the things that are in the report. I think it's always really useful to ground ourselves when we're talking about charities about some of the things that people will have seen throughout the reports, is that we need to remember that charities provide vital services and social capital that our people, communities and governments rely on. They're also a huge employer. And I think we forget this sometimes, that over 1.4 million people are employed in charities. And so they represent a very substantial part of the workforce. They also have a critical role to play in crisis and recovery. And you'll see in the report that charities have continued to step up and step in to the situations that we've seen, including not just the COVID response itself, but also bushfires and even this year floods in the East Coast. Charities also play a huge role in our economy and make a significant economic contribution. And in this report, for the first time, we also looked at the role of charities in the care economy, which is going to be a very fast growing part of the economy over the course of the next 5 years. And so it was useful for us to consider what the impact would be for charities. When we look at this fifth report and what the data is telling us, what we have found is that charities were better off financially than we expected, and that whereas 1 in 3 charities were operating in deficit prior to COVID, that number went down to 1 in 5 in 2020 and 2021. Clearly, JobKeeper had a big impact, but charities also were very prudent in their financial management, and we also saw some changes from our philanthropists in the way that they were funding. Despite that, you'll note that one of the reasons why there's a question mark in the title of the report about whether or not charities are moving beyond the crisis, that funding is temporary. And so what we have seen, and you'll see this in the report, is that despite the temporary supports, there are a number of headwinds. There are rising wage cost pressures and inflations. We've seen a very significant drop in volunteering, and service costs are rising at the same time. We also know from the analysis, and there's some new analysis in this report that's different from previous ones, that the impacts on charities were very, very different depending on what kind of charity you were looking at. So for example, in aged care, 54.9% of aged care charities were either running at a loss in 2021 or had a marginal surplus. And if you compare that to, for example, some of our emergency relief charities, 41.2% of emergency relief charities actually had a surplus of more than 15%. And so there are some big stories, but some different stories for charities. And the level of demand for some kinds of charity services have also is very high. And particularly in the community sector, you can see that the charities have reported an increase in demand for services through 2021, despite the falling rates of volunteering. We've also, in this report, as we have done previously, recommended an integrated package of reforms, and I'll mention them briefly here, but I'll come back at the end. So we believe that there needs to be a combination of a focus on the financial viability, which is ensuring the full costs of that, particularly in government contracts, to ensure that charities can meet demand, but that they can also deliver the outcomes that we want. We think that there are opportunities to make fundraising and philanthropy easier, that will also help the financial viability of our charities. We need to continue to build the capability and collaboration of the sector, and that includes the workforce capability. Workforce is going to be a big issue, but also volunteering because of the role it plays, not just in providing a resource, but also because of the participation and the social benefits that come from volunteering. Charities need to play an active role in not just welfare policy, but also in broader economic policy. And we do need to get better at measuring the outcomes of the work that the charity sector is doing so that we're ensuring that funding is flowing to the most important things. And finally, we do need to decrease demand for crisis services, both because we think there are better ways, including through increases in JobSeeker and other income support payments, which are the most effective ways based on the evidence in order to improve people's lives, but also because that will decrease demand for some of our crisis services. So as I said, one of the things that we found in the report is that demand for community sector support was high and it is likely to persist. 4 in 5 community sector charities have reported an increase in demand for their main services, particularly housing and homelessness services were a couple of those that were at the top of the list. And in 2021, just 6% of the survey respondents to ACOS's survey said that they could always able to meet demand. So demand is high, but part of the economic pressures that are currently being experienced by the community are also likely to flow through and include and ensure that there's increased demand over time, including the fact that inflation is outstripping wage growth. And one of the things about charities that we know is that unlike other kinds of organizations and particularly businesses, although demand goes up because many are working with fixed contracts, their income doesn't necessarily go up in order to meet demand. We also know from the last couple of years that some groups are going to be experiencing lasting impact, which will have an impact on the way that charities respond. So clearly women experienced the bulk of the cumulative losses of employment, and that's going to have a major impact on even things like retirement incomes, for example. And there were also a large number of women who took money out of their super during the COVID crisis and while that facility was available. Culturally and linguistically diverse communities were also disproportionately affected by lockdowns in multiple cities. Young people were disproportionately impacted by job losses. And although employment has definitely improved, we think that there are still some more work to be done about the employment ladder and the employment career ladder for young people. And although our communities have largely opened up, we also know that for people with disability and people with underlying illness, that they still face heightened risks of if they do happen to get COVID. And so that there are some of those groups are feeling even more isolated now than they have been over the course of the last couple of years when the relatively higher number of case numbers in the community makes it riskier. And to be clear, the experience of people with disability is different to the people with experiences with underlying illnesses, but nonetheless, there is some shared risk factor. And of course, one of the big things that did happen was that we saw the amazing outcomes for people of the coronavirus supplement, which effectively doubled income support. And what we've seen now from the evidence is that improved respondents' physical and mental health. It contributed to their overall well-being. It allowed them to engage in the labour market more effectively. So there were a range of benefits to that investment. But with the end of the coronavirus supplement, the estimate is that 700,000 people may have been put back into poverty as a result of that supplement ending. So if we turn to the financial health of the charities as we entered COVID, what we know, and for those who've been following along with this road, this is our 5th report. When we looked at this in the very first report, what we knew was that charities were operating on very thin margins going into COVID, and that was a real risk. As I said, charities are also different to businesses in terms of their ability to raise capital. charities are different to businesses, even in terms of the incentives that they can make use of. We saw during COVID that, for example, that there were some policies like tax incentives and asset write-offs, which were designed to support organizations, but which were not useful to charities and did support businesses that they were competing with. And charities have for a long time been talking about whether or not the contracts that they get with governments primarily, but also to some extent with some philanthropists, are actually covering the full costs of what they need to deliver. And those who are familiar with some of the work that we've done with our partners on the Paying What It Takes report will know that what we found is, although there's a myth within the community that says low levels of overhead means a charity is efficient, in reality, there's no relationship between levels of overhead and the level of impact that you can create. And in fact, that we think that there's been systemic underfunding of some of the indirect costs that charities need. So what happened to charities during COVID from a financial perspective? Well, as I said, 1 in 3 were operating in deficit prior to COVID. And that number reduced to 1 in 5. So overall, charities did improve their financial situation over the course of the last 2 years, largely thanks to the government supports, as I said, also because of some nimble work from our philanthropists who are willing to fund in different ways, and the prudent financial and decision-making that went on from our charities at the same time and our charity leaders. So what you're seeing in this graph, which is in the report, is that with the proportion of charities that were in surplus or deficit each year. So if you look to the right-hand side of that graph, what you can see is that in the green, we've gone from 67 to 78 to 77% of charities in surplus over the course of the last couple of years through COVID. In this graph, what we're looking at is the amount of JobKeeper received by not-for-profits and the number of organisations that received JobKeeper from April 2020 to March 2021. Now, I will call out that this is ATO data, and so this is also data which includes, as I said, not-for-profits. So this is not charities data, and so it's important to make that distinction because there are a much, much larger number of not-for-profits than there are charities. But what you can see, as I flagged earlier when we were looking at the timing for when JobKeeper payments were being paid to charities, that a very large number of not-for-profits did benefit at a peak around about 19,000 from receiving JobKeeper, and that there were some spikes in terms of the timing of when those payments came through. But you can also see that those payments were quite critical over those 2 years of 2020, 2021. And again, for those who've been following in our numerous reports when we've been talking about there needing to be a ramp rather than a cliff in the way that JobKeeper ended. It's a bit bumpy, but we did at least see a transition and staged removal of JobKeeper over time. One thing that interested us from the analysis is that what we saw was the income actually rose faster than expenditure. And so what you can see on this graph here is the relative rise in income, which is the total income in the dark blue, and the expenditure in the light blue. And you can see that gap opening up between the 21.5% and the 16.9% of the year-on-year growth with the baseline at 2018. Now, as most people would probably be aware, the biggest driver of costs for charities is employment. And so I haven't got the graphs here, they're certainly in the report, but one of the interesting things that did happen is that we saw a higher proportion of charities who decided to retain staff over the course of those years than was previously the case. So to give you an idea, that the proportion of charities in our match sample for this one who reduced the number of staff actually went down. So it was from 35% in 2018 to 2019 to 32 in 1920 and 26 in 2021. So people held on to staff. However, what we also saw was that the growth in employment year on year actually slowed. So going into COVID, there was actually a really steep growth at 14% in 18-19 in the number of employees that we were talking about. And that dropped to 4% and 3%. So staff were retained, but we also think that what has happened is that that people, in being prudent, have sought to carry some of that savings, some of those savings and some of the temporary payments from JobKeeper, and to use that as part of their planning for the course of the next 6 months, knowing that the money was temporary. What we saw in terms of income sources was that it was relatively stable except for the goods and services. So what you're looking at in this graph is the aggregate charity income by source. So just to take you through it, what you'll see is that the green here is government income, which as you can see is about half. The dark blue is goods and services, and that's the one that dropped, which is not surprising in some senses in that we were looking at a period where there was much reduced trading. So we were in lockdowns over the course of these periods of time. It's not surprising that there was reduced trading income. And as I said, government makes up the largest proportion. One thing that we do note, and we don't know for sure, is that obviously JobKeeper was a very unusual payment itself. And so it's not 100% clear about how charities have registered JobKeeper as to whether or not it was registered within their government income, or it could have been registered in their other income or other revenue. The other thing to note about these graphs is, of course, that whilst there are some payments which are ultimately coming from government, but which could be picked up from within goods and services. So for example, you're an NDIS provider and you're receiving a payment, the payment is coming from the client. Ultimately, obviously, that's being paid as part of a package that is being provided to that person. So the proportion that is actually originating with government is likely to be quite a lot higher. This next graph is quite complicated, so please bear with me and I'm going to walk you through it because this is actually one of the most interesting and one of the new pieces of analysis that we've done with the help of our friends at CSI. So what you're looking at here is that we've tried to understand a little more about what was the different impact for different kinds of charities during COVID. And so this graph is showing you the subsectors broken down by the primary activity that charities have identified themselves, and then ranking them according to whether or not a charity was making a loss. So the dark red on the left here is the proportion of charities in that subsector that was making a loss of 15% or more. And then in the dark green towards the black on the right-hand side, what you're looking at is the proportion of charities in that subsector which was making a surplus of 15% or more. So what you can see, for example, as I've mentioned right at the top, is that aged care charities particularly, so 54.9%, as I said, of aged care charities were either making a loss or a small surplus, which suggests that aged care charities, which we know have been under significant pressure during COVID, were more financially vulnerable than some other kinds of charities. If we skip to the other end of the chart, it will not surprise you that grant-making activities, charities that make grants, are in a much better financial position. And as I mentioned early on, if you look at emergency and relief charities, for example, quite an enormous percentage, 41.2% of emergency and relief charities were actually making a surplus of more than 15%. Now, clearly, emergency relief response was absolutely critical and has been not just with COVID, but also with bushfires and with floods. But it also begs a really important policy question for us over time about whether or not we are at risk of swinging the pendulum towards crisis responses, and what happens to early intervention and prevention and other services that we're investing in over time. We have more analysis on this particular piece, and so if people would like to know about that, please get in touch with us. We'd love to talk to you about it. One of the things that happens is that if you just ranked this according to the loss-making charities, for example, what you would see is that income support and maintenance, there are a higher proportion of those charities which are loss-making, but you can see that it's actually divided because there's also a fairly high proportion who had a significant surplus in 2021. Sporting charities were very unlikely relative to their peers to make a loss, was another one of the findings as we sort through these. So there is some interesting analysis about what's happening within the charities sector. So what's happening now to charities in terms of the operating environment they're facing post JobKeeper, as we've had this series of crises, both with COVID and with bushfires and floods. We do know, and the research is telling us, that there's increased burnout and illness. That's not a surprise, unfortunately, and is obviously not common and not unique to charities, but is definitely something that's happening. We're seeing an increased cost in tech infrastructure, and we saw a large proportion of charities move, obviously, to online delivery of services during COVID. There have been some really interesting investments, including from the New South Wales government through their social sector transformation fund, in improving the technology and capabilities of charities. And we'll be really interested to see how that plays out, but that's going to be an ongoing challenge. In some cases, we've also seen increased reporting obligations, although this has been a mixed picture for charities in terms of their experiences of dealing with government and funders during COVID. And we really have seen a very significant drop in volunteering hours. And that is something that should give us pause and cause for concern. The data that we've seen on that is that in 2021, 2.3 million less Australians volunteered than in 2019. 2.3 million. It's a very, very significant drop. And as I said, volunteers are not only a resource for charities, an incredibly important resource, but volunteering as an activity is also one of those things that builds the social capital within the community. Charities are also facing wage cost pressures. Again, no surprise, but clearly that's something that will impact them. And as many of them have fixed contracts, and particularly fixed contracts with government, there are questions about how to deal with those wage cost pressures because they can't necessarily respond to them by putting up prices in the way that a trading organisation might. There are also some risks around donations. So tightening household budgets and inflation may impact on donations from households. And if there are significant market fluctuations, if we go back into recession, then it is also possible that we could see some impact on donations from people like high net worth individuals, which we've got some experience and some other work that our friends at CSI have done in recent days about analysing what's happened with donations to high net worth individuals. We've seen from things like the GFC, for example, about what can happen to donations if there's if there are major changes in the market conditions. And as I said, the cost of delivering services is also increasing. So that overall, what I would say to you is that there is a significant risk that a number of the structural challenges that we know that existed back in 2019 and that we had identified could reassert themselves now that the temporary funding has washed through the system, and that there is that money has now been used in most cases by charities in order to deliver services. Another thing we do know is that if demand is still high, charities will try and cut their cloth in order to meet the heightened demand. And so that will place them under, and their staff under, increasing pressure. As I mentioned, we also did, for the first time in this report, do a spotlight on the care economy. And the reason for that is because the care economy is a very significant part of the economy when we think about disability, aged care, childcare, health and human services. With over 1.8 million employees. It's also one of the fastest growing employment sectors in the economy. So with the expectations of very significant growth over the coming decades. Unsurprisingly, what we find is that charities make up a large proportion of the care economy, but also some of the care economy's largest players are also charities. So if we think about the likes of Good Start Early Learning, or Uniting Care in the aged care space, some of our hospitals, for example, that some of our biggest players are also the largest players in those subsectors. And so correspondingly, what that means is that the things that are happening within the care economy are also going to have some profound impacts for charities. What that means is that as we embark on some of the reforms that are coming, we know that there are major reforms in childcare. We know that there are the implications of the Aged Care Royal Commission and the Disability Royal Commission, that charities need to be part of those debates. It's really important that we're not limiting the role of charities to particular subsectors or particular areas of policy. It's not just charities policy, it's also about economic policy, about care economy policy. And we also, unsurprisingly, but importantly, need to recognise, and there's some analysis in the report about the gendered impact of COVID on the workforce. Clearly, we know that the bulk of the care economy, that a high proportion of the care economy is made up of a female workforce. And that's the same in the charity sector as well. And so we've had a really interesting reevaluation within the sector, within the community, about the value of caring work during COVID, and we think that there are opportunities to change the debate, in a sense, about the role of caring it out and the value that we place on it, but also recognising that also has a profound impact on women, particularly given the proportion of the workforce that they make up. So finally, just to return to the recommendations, as I said, as a result of the analysis, these are some of the things that we think that would be particularly useful to consider in the future and consider in order to set up our charities to be really successful. So in order to ensure the financial viabilities of charities so that they can amplify their impact and improve their productivity, we do think that there's more work to do about how charities are contracted, and particularly around ensuring that charities have sufficient funding in their contracts to meet the total cost of delivering to the outcomes that we want to see, and to meeting demand where there is increased demand. so that charities can actually also invest in their people and that they can cover the costs of their IT, so that they can make sure that they can actually do the training that they need to do in order to deliver on the impact that we need from them. Similarly, as I said, making fundraising and philanthropy easier will be important, particularly at a time when it could be under pressure because of some of the other economic headwinds. Volunteering, we need to, as I said, build capacity and collaboration within the sector and across the sector. And clearly building the workforce capability and incentivizing volunteering is going to be part of that. We will be really interested to see what happens to volunteering over the course of the next couple of years and whether or not it bounces back. Charities do need to be involved in those broader economic debates, and we need to improve the way that we measure our impact to ensure that money is flowing to the most impactful things, and so that but also that we've got good data of the impact that charities are creating in the world. And at a time of increased demand, we do think that there are some policy measures that can be taken which would really help to reduce the demand on charities for crisis supports, particularly around income support, job seekers certainly, but also Commonwealth rent assistance at a time when housing costs for renters are still very, very high and certainly vacancy rates are very, very low, and parenting supports, because single parents particularly are one group we know are far more likely to be in financial stress. So those are three areas that we would need to look at. You will see our full disclaimer and the outline of the details about the organisation in the report. And so you're very welcome to read those things in the report. I won't go through them now. At this point, I would like to turn to our panel. It's 10:03, which means that I'm pretty close to time. I will stop sharing from the deck. I'm hopeful that people have had a chance to log some questions in the chat, and we'll certainly be looking to pass those on to our panellists. I am very grateful that the Honourable Andrew Leigh MP, the Minister, has joined us this morning, and I'm going to throw the first question to you, Andrew. I wonder, first of all, whether or not there's anything in the analysis that really surprised you, or whether you had other reflections that you wanted to share.
Well, Patrick, thanks very much for having me on. I'm joining you from Ngunnawal land, so let me acknowledge the Ngunnawal elders on whose lands I'm speaking today. I was really struck by the differences across sectors. When you look at the distinction between the financial viability of law and legal services and aged care activities, which are the most fragile, compared to animal protection, emergency and relief and religious activities, which are the most robust. And I guess I'd be fascinated to know, what are the drivers behind that? Did that have to do with the buffers beforehand or the shocks that came through the process of COVID? I'm also just really enthusiastic about the way in which you're bringing data to bear on this big challenge. The government set a target of doubling philanthropy by 2030, fixing fundraising through fundraising harmonisation, ensuring the Charities Commission is on the side of charities. We'll soon be announcing the new ongoing head of the Charities Commission, and ensuring that we work with charities in collaboration to build a stronger sector. So there's so much in this report that resonated, and so much that's just fascinating for a data boffin like me.
Andrew, you are definitely the right person for this job, and I've heard you say a couple of times that you are possibly the person who's most wanted the portfolio of Charities Minister, and I think, having heard you speak a few times, I think that is absolutely true, and we're delighted to have such a supporter in the role. One quick follow-up question. I know that you've also been going around the country and talking to communities yourself, and obviously have a deep interest in the way that we create social capital and community connection. I'm really interested to know, what have you heard on the ground from the charities that you've been speaking to in community about what their challenges are that they're facing, and what challenges they've got coming up?
Huge challenge of getting volunteers, I think, Patrick. And one of the striking things is that the organisations that you identify as the most financially fragile are also some of the organisations that speak to me about having the most difficulty getting volunteers. So in that sense, they're being hit with the double whammy of having fewer people working with them and fewer dollars in the bank. So there is that sense that it's harder to get volunteers. One of the, it's great, and we've got the unemployment rate with a 3 in front of it, but it does mean that there's fewer people available to volunteer. I think there's still a lot of fear of COVID around older volunteers, Organisations like Meals on Wheels highlight the challenge they've had in getting volunteers. So it's about trying to mobilise corporate volunteering, working through Volunteering Australia to ensure that that corporate volunteering is more than let's get the team out on Friday afternoon to pay the fence, and much more substantive, long-term engaged, and potentially even having corporate volunteering aligned with workplace giving. I think there's potential to boost them both up, but also to link them together.
Andrew, thank you. Arminé, I might want to turn to you next, and I just invite you equally to provide some initial reflections. I wonder, was there one thing that surprised you?
Well, Minister, you stole my one thing, so I have to say that was one of those things that, you know, it really was surprising, and it was something that I thought, wow, you know, what is driving this? Of course, there are probably a range of reasons, including the fact that revenue from donations might be greater for those types of charities in terms of, you know, sort of animal protection, of course, emergency relief, but also the fact that the demand for aged care and legal services, for example, far outstrips funding. So the strain on those services during COVID are not to be underestimated. I think another point that the report actually highlighted, which isn't new, but is important to recognize, is the fact that charities add around the same value to Australia's economy as the retail and construction sectors. So, you know, they employ more people than mining and manufacturing combined. And I think that point is actually often lost in the conversation, is really important to remind all of us, and particularly at the political level. I know this government recognizes that, and it's very important to continue to bring that to the fore.
Thank you. And a good segue and follow-up. And this is, Arminé, you've had an extensive experience in social and economic policy working inside government and are now leading one of the country's foremost social impact organisations. I'm really interested to know what, particularly with your government experience, what you think that charities have to offer, which is unique and which is, you know, as a support and a partner with government, but also things that they could do better and that they should know in dealing with governments.
Thanks, Patrick. Yeah, I mean, look, I think charities represent the best of our humanity. I don't really know that, we know that they're one of the linchpins of a civil society, but I think they often fill a social need that probably wouldn't otherwise be met. But they also bring us together, and they really do speak to our better angels. So, you know, there's those factors that we, the X factors of what it means to have a strong charity sector that we sometimes underappreciate. In terms of government, I'd say, you know, charities are often closer to the problem they're addressing, and therefore I would say closer to the solution as well. They're often much closer than government can be to the communities, to the people and issues that they serve. So I think the best charities have a very strong participatory approach and a connection to those with lived experience. And I think they're, you know, they have really unique factors that are sometimes a double-edged sword. So they're not restricted by the bottom line incentives inherent to the private sector, of course, because they're essentially in the business of public benefit. But the flip side is when demand increases or need increases, they're doing more with less. So I think we need to be looking at the system holistically, and a system really in the human services side that was really designed to respond to episodic need. And we need to sort of redefine how the funding works around that. I think when we look at perhaps my experience at the point of end in government and what I saw worked and didn't work, I would say one of the biggest mistakes I often see with charities, and in fact, not just with charities, but with other sectors as well, is not taking the time to build relationships at the political and apolitical level. I think it's probably worse with charities because of resource constraints, but I think the worst time to engage with government is when something's already going wrong, when funding's been cut or a key policy is about to change. And you know, I'm welcome the government's commitment to ensuring that charities have an active seat at the table. That's absolutely vital and so important. But charities also need to be proactive about relationship building. And that's not always with the minister. In fact, it's rarely, I think, with the minister. The minister has, you know, severe time constraints. following up semi-regularly with advisors, building relationships with backbenchers who will one day be ministers, and of course the public service, really important. It's slow work and it's a long game, but I've seen some great small scrappy charities do this really effectively, while some of the bigger names with greater resources don't. So, you know, when the time is right and you need to engage to ask for something specific, it's really important to be really tight on what that request is and understand how that will play to the incentives of the government of the day. Finally, I'd say something that's perhaps particularly unique to the charity sector is an opportunity around coordination and coalition building. So coordinating efforts for funding asks, for example, might seem slightly counterintuitive. In my experience, it's a lot more effective. You know, government wants to work with the sector for better outcomes, but it's very hard to kind of pick winners in that. You know, there are lots of interesting groups actually springing up in the human services sector that are working together to build a unified voice to government around systems change. So that bottom-up coordinated effort is really hard, but it's much more likely to be successful than one charity coming in with their big idea or big funding ask and pitching it to government.
Fantastic, thank you. And Andrew, I'll put you on notice for later that I do have a question about competition and collaboration later on. As the Minister for Competition, I would love your views on that one too. Susie, at SVA, we partner with and talk to literally hundreds of charities and not-for-profits. It's one of the joys and benefits of the work that we do. I'm really interested in what your assessment is of the data that we've seen and how that squares with what the SVA experience has been over the last couple of years.
Thanks, Patrick. Another cheer from me for the role of bringing data to the conversation. And I saw John McLeod is another one of the data nerds that's here with us today. I think it is really pleasing to see that the prudent decision-making from charity leaders and the temporary supports from things like JobKeeper worked. Not so much the financial health, which is hard to get that excited about, but in terms of what it allowed us to see happen in society. So people stayed in jobs, and we were really worried about that in early 2020, that charities would have no choice but to let people go and that we'd end up adding to the demand for crisis services provided by those charities. And also in terms of charities' ability to meet the needs of people in communities when they were experiencing crises. So that was pleasing to be able to see, and difficult to stack up when you're only relying on anecdotal storytelling from charities that you have close relationships with. So that was news to me. I think the good thing about charity leaders responding quickly with that prudent decision making and finding innovative ways to deliver services, to adapt to their staff needing to be online or meeting new needs and as they were arising inside communities, talks to the heart of people who work in the charity sector and the ability to be responsive and innovative and creative when needed. So those pieces are all really reassuring. We just heard Arminé and Andrew Leigh both talk about the variability. This doesn't tell us a lot about the why we're seeing variability in those subsectors, and we all have a lot of curiosity about what is driving that, and our concern is for what the implications might be for quality, for safety, for inclusion of those who experience the most disadvantage and vulnerability and might be the most difficult to reach, and for the people who are delivering these services to community about what happens when times are tough for such an extended period of time for our talented staff and volunteers in the charity sector. So I guess what worries me most, and I hear this from the dozens of charity leaders that I interact with in my role, is when the attitude is we should just lean in and do more with less. And as though that's a sustainable solution. We know that if we want to deliver great outcomes for people, we need to keep in mind safety, staff well-being, quality, investment in monitoring and evaluation and learning so that we know that the things that we're doing actually work, innovation and technology and things for the future like our financial reserves for the next rainy day. So those are the things that people are kept awake at night about in terms of what's around the corner.
Thanks, Susie. Andrew, I'm going to come back to you, and one of the big pieces for us, and one of the things which I think, as a couple of people have highlighted, is that although charities represent such a large part of the workforce and such a significant contribution to the economy, they're not necessarily always at the center of the big debates that are going on. And I guess my question to you is, what do we need to do in order for charities to really have a seat at the table in the big debates? We're fortunate to have a minister who's also sitting in the Treasury cluster. And so, you have some access to some of the big debates. But the example that I often give and have given to many people over the last couple of years is we saw research and development incentives, and we saw tax write-offs, and we saw things which brought forward business investment, which were in some senses good policy to support business during the pandemic. But there was no thought given to how does that actually impact on a charity, which is operating side by side next door in some cases. What do we need to do to get charities at the centre of some of these debates?
Thanks, Patrick. And certainly our view within Labor was that the charities portfolio should sit within Treasury, not as it did with the other side of politics for a while within social services, because charities are fundamentally about the good of society and about the strength of the social fabric. I first got interested in this area 20 years ago when I was working in the research team of Robert Putnam just after he brought out Bowling Alone. And I really do have that sense that the fraying of Australian community matters not just as an instrumental thing, but of itself. It is better to live in a society where people have more friends, join more organisations, do more volunteering. So that's why it's within the Treasury portfolio. It sits very neatly with the Treasurer's move towards wellbeing budgeting. Jim's very concerned about making sure that we're measuring what matters. And to use Arminé's words, if charities represent the best of our humanity, then a wellbeing budget should reflect the health of charities. I think there is a sort of marker here, Patrick, about politicians' views on charities when we look at one of the scandals from the last election, which arose from a series of members of Parliament plastering their election flyers with unauthorised so-called endorsements from charity sector leaders. The reason that they did that is because charities have far higher public standing than politicians. So put the scandal aside, I think there is that sense among many of my parliamentary colleagues that they would like to be associated with charities, that they'd like to see a stronger charitable sector. And that's why this report's so important, because it does that deep dive, looks at the finances and really puts a spotlight on where organisations are doing okay and where they really need assistance.
Thanks, Andrew. One of the interesting things I think that we've been reflecting on over the last couple of years is the role of philanthropy in driving innovation and research and development. It's a much smaller pool than government funding, but in lots of ways, government is the biggest beneficiary of the new innovations that are funded by philanthropy, because it can be more nimble and it can and take on some more risks. I'm really interested, as the minister, how can we get more of that innovation that's funded by philanthropy into a pipeline of government programs so that we're seeing a cycle of renewal and improvement that's constantly going on, because it feels at times that can be broken. I'm wondering if you've got ideas about that as someone who is deeply interested in the data and about what works and what doesn't.
Great question, Patrick. This actually came up in a conversation, a Melbourne roundtable yesterday with my colleagues Josh Burns and Weza Chow and Paran, talking about the role of philanthropy in spurring innovation. And I do think that philanthropists should be aiming to do things which are different from what government does. One of those is that government typically has an obligation to serve everyone. And so policy experimentation, at its very nature, often involves having a group of people who don't receive the intervention so you can work out whether the intervention works. That's easier for a philanthropist to do because no one expects the Paul Ramsay Foundation to serve all 26 million Australians in the way in which the Australian government has that same expectation. So there's a range of organisations which are seeing their philanthropic funding as effectively being their innovation funding, their upskilling funding, their funding to ensure that they're able to do something differently in the next decade than they do in this decade.
Thank you. Arminé, I might come to you on the question of philanthropy. CSI has also recently published another wonderful report about what's happening with high net worth individuals and giving from private ancillary funds and public ancillary funds in Australia, suggesting that we're falling behind some of the other comparable countries. I'd really love to know your thoughts on what do we need to do in order to increase that share of our philanthropic funding, particularly at a time where it could be under pressure if we see some market volatility.
Yeah, absolutely. I mean, look, it was a really interesting report, and I think probably the most comprehensive look, at various data sets. But even that data isn't perfect because there's not a lot of transparency, particularly at the ultra high net worth giving end. I think there's a lot of interesting conversations we need to have about the conduits to philanthropy and the conduits to high net worth giving in particular. Who are the people that are the trust actors in those relationships, the advisors? How do we ensure that they're well equipped to understand what good giving looks like and how to help guide high net worth giving? I also think there has to be a better culture in Australia of celebrating giving. We're sort of, there are cultural factors there. I don't want to call it the tall poppy syndrome because that's a bit, but it's a factor. I think people are less willing to put their hand up and pat people on the back for doing something good. And philanthropists are actually often under attack from a variety of angles. And I can see why, I understand why, but it's if we want to recognize the role that philanthropy plays, and which is often risk capital, which is often doing the things government can't do and shouldn't do because they're responsible for the public purse. We need to be better at celebrating the achievements. We need to be better at working as a community to ensure that some of those, I think, perhaps risk capital endeavors are then not just dropped once they're proven to work, but actually adopted at scale by government. So perhaps that closer relationship, which this government is trying to foster, will help ensure that some of those, I think, innovations are actually adopted at scale and not just sort of dropped. We do randomized controlled trials, figure out something works, and then it's never implemented. I saw that in my time in government over and over again. It was a great frustration. I think there are actually some cultural impediments to that we can address.
Thank you, Susie. I might turn to you on this question too before we move to the next piece, which is that SVA spends a lot of time thinking about how to get things to scale. And the point that you just made, Arminé, of we see time and again where we can have some very high quality evidence of something, and particularly with that risk capital from philanthropists, doesn't always translate into it being adopted or more widely through the system, which was one of SVA's great ambitions in what we're doing. Susie, I wonder what your thoughts are about the challenges getting from pilot to policy.
Thanks, Patrick. We know that it can happen. It doesn't automatically happen. Evidence is absolutely critical. To reiterate the point, we need to understand whether something works. It is irresponsible to scale things that we don't understand what kind of impact they have, in what context, for which populations, and for what lasting duration. So measuring things and monitoring and evaluation is vital, and we need to know what stage things are up to in order to know what kind of monitoring evaluation is most appropriate. And there's a real role for government in providing access to data sets, smart ways to assess whether things work, collaborations across the not-for-profit sector and across jurisdictions so that we can measure things in clever ways. So evidence is absolutely critical. That's a real hygiene factor. Collaboration is something that's also come up from the other speakers as well. We need to work across sectors and jurisdictions if we're going to understand how to scale things that work. So government is obviously, or governments are the largest funders, regulators and deliverers of services that help improve people's lives. They can do the scale part, but the innovation tends to come from outside of government, from community-led initiatives, from charities, from businesses, social entrepreneurs, from philanthropists. And so we need to be really skilled at working across and within that ecosystem so that we understand what's driving those different kinds of people and organisations, and how can we work together, what are our complementary roles, when do we maybe need to hold back, and when do we need to step in and take the lead. And finally, keeping people at the centre of the work. What actually matters to the people whose lives are most affected by the work, and how are they included in the design of the approaches, in the delivery of the approaches, and in the evaluation of the approaches that aim to improve outcomes in their lives. And that is definitely shown to be a better approach in terms of ensuring that we're working on what actually matters and that things that are being designed are more likely to have lasting impact. So taking a different approach, whether you're at the early stage or whether you are at that scaling point, and keeping evidence, collaboration, and people at the centre front of mind.
Thanks, Susie. I'm going to use that as a leap-off point, Andrew, to return to the question I mentioned to you earlier that I was keen to put to you, which is about this question of competition and collaboration. You're also the Minister for Competition. You also have some deep expertise in your academic life about the concentration in Australian markets. I'm really interested to know what your thoughts are about the role of competition and collaboration in the charities sector, given some of the complexities that Susie just talked about how we create social change can require more collaboration. And also, as Arminé said, that multiple charities coming together to government is often what governments would prefer in terms of the way that we interact. So I'm really interested in with your other hat on, what your thoughts are about how that should or shouldn't operate within the charity sector.
Thanks, Patrick. Certainly, Arminé's comment about ensuring that we've got consortiums of organisations coming forward is something that I'm hearing from philanthropic funders. One large foundation said to me recently, look, we really are skewing almost entirely towards groups of entities that come and pitch for funding over individual organisations. Within government, we need to make sure that we're creating space for smaller local service delivery organisations to still get a look in. We're not just giving contracts out to big national organisations and losing that kind of local touch and local expertise. But I also think that while there might be instances in which it's healthy for charities to merge or to do some kind of a joint venture, I'd also love to see more startup charities. I think of Orange Sky Laundry, started by a couple of young 20-somethings in Brisbane, filling a niche that people wouldn't have identified before. Why don't we go and put a couple of washing machines in the back of a van? What? Washing machines in the back of a van? Are you crazy? But yet what they've created really works. And that's partly because the washing machines are a way of starting a conversation with people who are marginalised in society. If you look at the directory of Australian associations, it goes back to the late 1970s, and you can track the number of associations per Australian, and that's fallen by 4/5 over that period. So we do have fewer associations, at least those listed in the directory, per person than we used to. I'd like to see a whole lot more startup charities, which are potentially finding new ways of doing things and also filling niches that aren't yet filled. And part of the civic renaissance that I'm keen to engender is through the charities portfolio is people starting more new and innovative charities.
Thank you. We're bang on 10:30, so I'm going to start moving to some of the questions that our wonderful participants have asked, and I've got a few of them coming through, so I'll go through them sequentially. Susie, the first one to you is, in a sense, a little bit of a Dorothy Dixon, but an important one and a useful one, which is if you can tell us some more about the Partners in Recovery series, this being the 5th report. So why did we partner on this series and start doing this particular piece of work?
We wanted to partner with the Centre for Social Impact because we felt we had complementary skills and wanted to be good role models of working together in the sector, just as we've heard, rather than going it alone. So that was why we wanted to partner. The reason why we wanted to do the work was to bring some data to the conversation that was happening in early 2020 after the pandemic first really hit Australia, around what was likely to happen to charities, financial health, and therefore what might happen to jobs. So for those who remember, what the debate was all about was very, very focused on jobs. So we wanted to bring jobs into the conversation, make it data informed. And so it was a prospective modelling exercise to look at the ACNC data, the Australian Not-for-Profit Commission, Charities and Not-for-Profits Commission data, to actually model what might happen in terms of numbers of jobs and potential drops in income. And we were concerned for the outcomes for people and communities. We also wanted to bring into the spotlight the different nature of charities as entities, and therefore the different degrees of freedom that they had to make changes in the face of an acute financial crisis. So charities can't raise equity, that's not allowed or appropriate. A lot of debt is not fit for purpose for not-for-profits and for charities. And so while businesses might have quickly gone to the capital markets to raise equity or to find debt so that they'd be able to continue, neither of those avenues was really available or appropriate for charities. Most charities don't have very significant balance sheet reserves in order to rely on that getting them through an acute financial crisis. And so when we looked at the financial makeup of most charities' P&L, their profit and loss, their financial performance, 75% of the costs are staffing costs. So if you can't raise more capital easily, the only real lever you've got if your income drops is to cut expenses. And it was pretty quick for us to realize that you'd likely cut jobs. So that was the original motivation. We then wanted to play into what the different models of JobKeeper might look like and the timeframes to influence the debate. We were not the only ones, but we were trying to bring that quantitative data informed analysis, and then to provide snapshots as things moved in terms of what government's policy decisions had been, what had happened in terms of the different waves of the COVID pandemic from a social perspective as well as a financial perspective. And this time now in September 2022 was to be able to start to say what actually panned out. So the beginning was a prospective, what do we think might happen? Now we're starting to look at what has happened. What we wish was that there was a tiny lag between ACNC data reporting and when we could provide this data, but we do know that there is a reasonable time lag. And then we've looked at a few things like the gender lens, the care economy, because they are absolutely vital and critical in terms of what charities provide as services to society. I will use this question as an opportunity to invite everyone on this call to suggest to us what would you like our collaboration to provide next? Which questions are top of mind for you? And where do you think there are data sets that we might be able to analyse to bring some answers to the conversation, or at least some indicative things that people would be curious about? Because we would like to keep doing this work if it's of use. We're certainly not going to do it just because it's a fun thing to do. So if there's questions that are top of mind that we can answer, we'd love to help.
Thanks, Susie. And by way of bridge to the next question, I'll just make a couple of small comments. One is to say, Andrew, it's really an interesting question about the sort of new charities and what would, new startups and what's happening in that space. We'll also sort of provide a shout out to our friends at the ACNC, and we've had some really valuable discussions with them. One of the things I mentioned up top, and I think it is useful to highlight, is that that there is a risk, and we think that particularly with the drop of volunteering, that many small charities, or those that may have even been outside of our sample, there's a risk that many of those did shut down, and there's a question about whether or not they'll come back. We don't know yet. I certainly don't know, but I do think that that's one of the risks of what has happened over the course of the last couple of years. There was also a question about the extent to which surpluses for some kinds of charities may not have been able to be spent. I may answer that one myself, just simply because it relates mostly to the data that was presented. Yes, that's absolutely possible. We think that that certainly for emergency relief charities, that there's it is definitely possible that the money that has been that has come in either from government or from philanthropy is being used through the recovery phase. And so that's part of the reason why those why there was such a significant surplus at that particular point in time. So that's definitely possible. To move back to one of the other questions about regulation, Andrew, I might put this one to you. We did really hear, and there were some mixed reports about the way that regulators operated during the course of the pandemic. And as we've seen, it's like the charity sector is incredibly diverse, and because of the number of different sectors, subsectors that it operates in, subject to many different kinds of regulation. If you're an aged care provider, you have a very different set of regulations to what you do if you're an early childhood provider or an arts organisation. And so I'm interested to know what your thoughts are about the future of the regulatory environment, including the role of the ACNC.
So one of the comments that I got when we started doing these building community forums around Australia is it's really nice to have a charities minister that likes charities. And I think that ought to be the default view of the regulator as well. Of course, it has a legal obligation. Charities need to be shut down if they're doing the wrong thing. That's important in maintaining the public confidence in the sector. But their default approach ought to be that they have a warm and positive view towards the role that charities play in the community, just as the default approach of ASIC is to have a positive view of the role that businesses play in sustaining Australian living standards. I don't think there's there's a contradiction between those two roles, but the sort of antagonistic approach that the former head of the Charities Commission, Gary Johns, took towards many charities, the fact that he had largely made his name as a critic of charities rather than somebody working in the charity sector, I think really did affect confidence in the sector. And when you look at the 3 open letters that the charity sector wrote to successive coalition prime ministers complaining about attacks on the sector, part of that is the view that the former government had that charities should be seen and not heard, that they should be planting trees but not talking about deforestation, helping in community legal centres but not talking about law reform, serving in soup kitchens but not talking about inequality and poverty. We have a fundamentally different view. We think the public debate is enriched through the voices of charities and that we all benefit as a society from having the sort of public conversation that brings those voices of lived experience into policymaking.
Thanks, Andrew. And yes, it's always the challenge to be open to the criticism that comes with being open to the debate. And so I'm sure that lots of people will be holding you to account for that as the advocacy ramps up over the course of the next couple of years. Question about the sort of the funding conditions and contracts. And again, this is technical, but a very common challenge for charities is that if costs are increasing during the course of contracts, charities often don't have the same opportunities to change their pricing. They can't change their pricing during mid-contract. I wonder if you, and not only that, but when they're experiencing inflation, they quite often then need to absorb that inflation within the costs of what they're doing. I wonder if you've got thoughts about how governments contract with charities and what we might, we're in an inflationary environment we haven't experienced for quite a significant amount of time, about what approaches we could take to dealing with those increased cost pressures within contract terms.
Absolutely, Patrick. And when I was on the House Economics Committee in the last term of Parliament, I was spending a lot of time being critical of the Reserve Bank governor for the fact that inflation was undershooting the Reserve Bank's target band. Right now, we've got obviously the reverse problem, and that puts a significant challenge on organisations that have contracted to deliver a given service and are now seeing the prices of everything go up. One of the things Amanda Rishworth has said is that she will look to have longer dated contracts, which will provide more certainty and also to get indexation fairer. We're aware that indexation has been a big problem in many sectors. And when you have indexation that isn't fair, then you have often a flow through to the sorts of careers that people can have in the charity and not-for-profit sector. If your organisation is funded by one-year grants which aren't properly indexed, then you're not going to have the sort of career investment and the long-term training that we want to see in building up the expertise of the sector. Aged care is where the rubbers hit the road most immediately. The government's made a submission to Fair Work Australia calling for an increase in the pay of aged care workers and saying that if that is granted, that we would honour our part of that financial commitment. But more broadly, we're certainly open to getting indexation fairer across a range of contracts and thinking about how we build in price adjustments in an inflationary environment.
I wonder if I can take you back to the wellbeing budget. Actually, I should ask, just to be cheeky about it, whether or not you can tell us sort of what the time frame is for us to hear about the next ACNC commissioner. I don't know whether or not that's something that you're able to share.
Soon.
You won't budge to imminent. So. I'm sure there were many people on this call and elsewhere who will be very keen to we'll be waiting with bated breath, so to speak. On the wellbeing budget.
Let me put it this way, Patrick. The people on this call will be happy when they hear about the appointment. I have no doubt about that.
There you go. Thank you.
The last commissioner was announced in the hours after the marriage equality vote passed the Parliament, in an exercise which was clearly designed to shield the announcement from public scrutiny. This is the kind of announcement we would be very happy making on a day in which there was no other news happening, because I'm confident that the announcement of the new ACNC commissioner will be warmly welcomed by the sector.
Fantastic. There you go, folks. You heard it first here, and so your hour and a half was well spent. Thank you, Minister. We ask kind of fast approaching a wellbeing budget, and as an economist, you're trained around incentives and sort of, understanding sort of what to measure in order to change behaviour. I'm quite interested. Obviously, I'm not going to ask you also for a scoop about what's going to be in the budget, but I am really interested to know what your thoughts are about how these measurements will be used and what kinds of measurements will be used as part of a wellbeing budget. Because that, in a sense, is, if the aphorism is that what gets measured gets done, then the measurements themselves are clearly quite important. So really interested in your thoughts as someone who's got deep expertise in that area.
Yeah, absolutely. I mean, we teach students in the first day of first year economics that economics is about maximising well-being or happiness or utility, if you're taking a more wonkish approach. No one who's studied any amount of economics would think that economics is about maximising money. For example, in the period since I've been alive, life expectancy has gone up a decade and real incomes have doubled. My guess is if you could only have one of those two things, many of us would choose the extra 10 years of life rather than the doubling of per capita incomes. So wellbeing budgeting needs to look at things like longevity, how many additional healthy years we have, about the extent to which incomes are broadly shared across the community. New Zealand moved into wellbeing budgeting in part because they wanted to focus on the measure of child poverty, which is certainly a relevant consideration in Australia. And then I think these questions of community ought to be front and centre. When Nick Terrell and I wrote Reconnected, one of the things we did was went back and refielded a survey that had been asked in 1984, asking people how many friends they had. And we found that since 1984, the average Australian had shed half their friends and knew only half as many neighbours. That strikes me as a wellbeing measure. So Jim said that budget paper 4 will focus on a discussion around the wellbeing measures. I don't think you should expect that this will lock in a particular approach to wellbeing budgeting, rather that it will be an important part of the conversation as we broaden out a measurement of what really matters.
Thank you. Arminé, I want to turn to you at this point. CSI has done some amazing work, particularly through your Amplify project, about sort of what indicators are useful and the use of common indicators. And Andrew, in a sense, a wellbeing budget is sort of the largest framework, if you like, for a common set of indicators to think about how we spend money. One of the things that is I think is part of the regulatory environment for charities and is part of their experience is that they can need to collect many different kinds of data for different masters, depending on where they get their funding and if they get a diverse source set of funding. Arminé, I'm really interested in your thoughts on the value of common sets of indicators and how those can be used, particularly given, as I said, CSI has done so much work on looking at some common sets of indicators.
Thanks, Patrick. Yeah, I mean, look, the Amplify program, and I encourage everyone on the call to check it out if they haven't on the CSI website. But it's a suite of measures of which the first sort of launch was something called the Social Progress Index, which kind of says, beyond GDP alone, Australia needs an index that shows how people and the environment in each of our states and territories are faring. So, we were proud to launch that, and I think that's something that recognizes that we need a measure of quality of life for people across the country. And, you know, it's sort of the first, I think, ever holistic measure of Australia's social performance that is independent of economic factors. And it'll show the performance of our states and territories as aligned with the UN SDGs, the Sustainable Development Goals. I think the other bit of Amplify that's probably worth covering here is about allowing organizations to more seamlessly measure their impact using validated indicators. And then over time, what we will hope to do with that data once that comes in is start to understand, well, with the right amount of inputs, where that data sits and where organizations sit in terms of their impacts. It is a huge area of investment. I'm really excited that the government has, I think time and time again, actually, in the lead up to the election, during the election, and now indicated how important this is. So I'm, part of what we do at CSI is providing that resource to the community sector, allowing the smaller organizations in particular that may not be able to afford the more bespoke services that we offer and SVA and others offer, to be able to get in there and use at least validated indicators. And once we kind of get more data in, we'll start to see how we can coalesce around the key kind of points that allow us to understand where we sit as a nation, where we sit on a state basis, and where we sit organizationally within our sectors. So it's, SPI, the Social Progress Index, allows us to kind of compare jurisdictions and track them over time. And it reveals which components of social progress are flourishing and where there are gaps, which we hope will help government and the sector sort of focus on what's missing and where the gaps are with the right level of data, so that we're not kind of flying blind on those issues.
And Minister, back to you. Thank you, Arminé. I wonder, as someone as sort of self-confessed data nerd, what your thoughts are about ensuring that government data sets, which are often, and administrative data sets, which are often incredibly rich and which we rely on in order to better understand how we're creating impact, can be made more available as well to charities so that they can better understand their impact in the world.
Well, Patrick, one of the things that I felt was a terrible omission from this report was an Appendix C, which said, here are the data issues that we faced, and here's what we could have done more of if we'd had different data. Clearly I should have highlighted that early on. But no, you don't need to.
That definitely should have been your most surprising thing, was our lack of analysis of what additional data we need. But we will definitely take that one on notice. So.
I mean, it's a great report. Like, it really shows the value of delving deep into this data and shows to the community what the community gets back from having good access to administrative data. And obviously, you've done a terrific analysis based on that publicly available data. But I'd be curious, as the Minister, and also, as it happens, the Minister responsible for the Australian Bureau of Statistics, to know what more you could have done. What's the next data set that would have been really useful to you? We've released a lot more data through data.gov.au. The DAT Act, which passed Parliament recently, creates a framework for data sharing, which I think is going to be important. And David Gruen, heading the Australian Bureau of Statistics, is somebody who comes from a researcher's background, engages very deeply with researchers, and is keen to free the data to the extent that we're able to do that within the constraints of ensuring confidentiality and privacy. So it's a good time to be a data boffin, and if we can help get into additional data sets out there, let me know what needs to be opened up.
Thank you. And I was being facetious. Absolutely welcome the feedback. And what I would say to the people who are still on the call is that we would love to hear from you as well about what, just as Susie provided the invitation about, like, what other questions would you like to know? Obviously, in trying to answer some of those, Andrew, we will no doubt find out the limitations of what we can and can't answer. Even to give you one example, we know from when we've looked several times at trying to understand the impact of JobKeeper better, the data that was available to us from the ATO was quite limited. And as I said, we obviously used not-for-profit data in that case. But to better understand what happens with the removal of JobKeeper, that's definitely one area which we struggled with repeatedly over the course of the last couple of years, but was clearly very important. Susie, yes, go for it.
I wanted to add to this point that it also highlights the need for skills and capability investment in the charities sector to be able to interact with the data, to understand how to take advantage of those new data sets that exist and to be able to use them effectively and efficiently. It won't automatically translate into charities measuring their impact and being able to report more succinctly unless we've got the right kinds of skills and capabilities for people to be able to do that, from intermediaries, universities, academics, but also inside the inside the charities themselves.
Susie, I might ask a quick follow-up question because I was heading back that direction. Obviously, another one of the things that SVA does do a lot of is work with charities on outcomes frameworks. And, you know, increasingly, what we've been doing is working with charities on common outcomes frameworks in order to get some better alignment across multiple organizations. I wonder if you could talk a little bit about the challenges that raises in trying to do common outcomes frameworks, because in a sense, that is where the availability of data hits the real world experience of what do charities need to do to improve their practice in order to actually embed the learnings that come from collecting that data.
Social Ventures Australia has worked with a large number of charities, not-for-profits, social enterprises, social purpose organisations, either individually or in collectives, around how to think about their outcomes and collecting the data and communicating the information for decision making or for influencing other actors. And one of the biggest challenges is getting to simplicity. And I imagine that Jim Chalmers and his team is facing that in thinking about a wellbeing budget for the entire country. A few simple measures that really matter, that are going to be achievable to monitor on an ongoing basis, can be much more powerful than a long, complex set of things that are unwieldy, unlikely to be rigorously repeated again and again, and eventually suffer from neglect. So the simplicity point is key. The other challenge, whenever you're asking people to collaborate to come up with something in common, is that there's compromises and trade-offs. And some people might have real attachment to the way that they've been measuring things for a long time. And we come up with the whose rail gauge should be the common rail gauge question a lot. And coming back to the higher moral purpose of why are we trying to do this is probably our most common approach. It's not about you and your charity and your particular research methodology. It's about the driving of better outcomes for people and communities, and the ability for us to make better informed decisions, to influence policy, to influence funding, and to influence practice. But I'd say there's a lot of skill and art and craft in being able to navigate those conversations, and it takes a lot of time to get to common frameworks. When it is achieved, getting something common and getting something simple, I think it's incredibly powerful. And people always say, gee, this was worthwhile because now we've got a common way of talking about things. We can compare, we can learn from best practice, and we can certainly influence and advocate in a much more effective way because we've got a common framework and a common set of measures.
And Arminé, I might turn to you at that point, and then Minister, I have one final question for you to follow that. You were in government at a time when we had a set of Premier's priorities where there were some very distinct targets, and that I would love to hear how you feel those drove and changed behaviour in the way that policymaking and government worked as a result of having a really clear set of targets and the utility of that kind of approach.
Yeah, I mean, the Premier's priorities use, the deliverology method, Sir Michael Barber's method from the UK. It's a lot of that is setting the target that is set in consultation, and then ultimately building routines around government at the highest levels down to the front line to change behavior and change the way that, and a little bit more of a try, test, learn approach to sort of novel interventions. I think the sustained focus is really useful, and sustained focus at a leadership level in really, I think, stubborn systems that don't easily shift. And having a North Star through a target can be really effective, and it does. You see when decisions need to be taken to reorganize efforts. So, for example, during the pandemic, some of the reforms around street sleeping, and what we had to prioritize as a government to ensure that that cohort of people who are homeless and on the street were prioritized. I do think that under the underpinning sort of framework that said, well, this is a primaries priority, we have to achieve it, we have to redirect resources to achieve it, was really important. Now, the flip side, of course, is sometimes when you're really, really strictly measuring something, there are other activities that you are perhaps not doing. So I think the design of those priorities is always really vital, and similarly, we see that in how we design bonds and social impact bonds and other structures. So I think there's certainly a really clear place, particularly where you have a well-consulted priority and where there are perhaps a lot of different systems that are a bit siloed, bringing them together and bringing routines around that and bringing, I think, accountability around that at the top, and changing systems and inputting a lot of that was learning from the front line, hearing at the, that loop that is sometimes missing, bringing that loop to the fore. There were great opportunities that came out of that work. But, they're imperfect. And I think we have to keep refining, and we have to keep being really, really careful about how we ask the question of what it is that we're targeting and why. That design point is perhaps, I think, underdone. It's to me the most important bit. Getting that right is really important. But yes, very much an interesting experiment in New South Wales, and I think New South Wales is recognized globally as one of the leaders in the way that that primaries priorities or deliverology methodology was implemented. But yes, it's a very very important to get the actual targets right.
And I have it in my notes here, I won't go into it, but thank you for calling out the situation around homelessness in New South Wales. I would encourage people, if you have a chance, even just to look at even some of the media coverage of the fact that we've seen a halving of people sleeping rough in the city of Sydney, which is quite remarkable, but does show that when you prioritise something, you have the right sets of actors between the partnership between government, community housing providers and service providers with the right service, that very significant change can be achieved, even though that had not been achieved in the previous 5 years. So I think that there are some great examples of what happens when you prioritise. We are nearly at time. So Minister, I wanted to come back to you for one final question, which is actually about the Impact Investing Task Force. You would no doubt be aware, and we were certainly very pleased, SVA and others, that there was some focus with the previous government with the impact investing market. It's certainly not going to replace government funding or philanthropic funding, but it has a role, we think, in terms of creating change. Unfortunately, that had stalled somewhat prior to the election, and we never saw the final report of the Impact Investing Task Force chaired by our former CEO, Michael Trail. I wonder what your thoughts are about the future of impact investing in Australia, and indeed whether or not we may be able to exhume, I'm not sure what the right word is, that particular report post-election, given that it is now an artifact of the previous government.
Yeah, Patrick, I'm very happy to look into whether we can get that report out. Certainly, I've got mountains of respect for Michael and his work. I think impact investing is important in terms of unlocking new sources of funding for charities and not-for-profits. I'm most excited by it when it's tied to a rigorous evaluation framework. So if you've got a very clear counterfactual, you can figure out whether the program is actually working. If it's effectively paying for a pilot, then your counterfactual is less clear and you don't get the kind of learning benefits that I think is the real double dividends that good impact investing model can have. But again, from me, congratulations on a fabulous report, and to everyone who's taken the time to join a long and fruitful Zoom call, thank you.
Thank you, and thank you to you for making time for us today. We really do appreciate it, and also thank you to Susie and to Arminé for your comments and insights about the report. As I said, you can read it online. It's been posted also in the chat. So I'd really encourage you to ask us questions, and if there are things that are missing or incorrect, come back to us about those things too. So thank you all, and I will ask my partners at CSI to end the Zoom call now.